dietitian here at Conway Medical Center, and today we're going to talk about ways to troubleshoot side effects for weight loss during cancer treatment. And this also is information that can help before treatment and then after treatment. So nutrition in cancer care is nutrition helps with recovery, with healing, with regaining strength and weight, maintaining ongoing side effects, reducing risk of future cancer diagnoses, and keeping you generally healthy and maintaining a healthy weight. So nausea is a common complaint during treatment. So trying to choose foods that appeal to you and not to force yourself to eat foods that make you feel sick. And do not try to eat your favorite foods when you're feeling ill, because that can give you at least your favorite foods are your go-to foods that you can go back to. So if you're feeling ill during those times, you don't want to have your favorite foods, because then you can get an aversion to those favorite foods, and then you won't have anything left in your arsenal to try. Eat foods that are soft and bland and easy to digest rather than heavy foods such as high-fat foods. And then eat foods that are dry, such as crackers, toast, breadsticks, and eat those throughout the day. And sometimes you even may have to keep some crackers or something at bedside to eat those before you even get out of bed. And sometimes that can help with that early morning nausea. And eat foods that are easy on your stomach, toast, yogurt, clear broths, and keep a daily log to see if you can kind of troubleshoot ideas that are going to help. If you can figure out what has made you nauseated, try to avoid those things and then add the good things that seem to settle your stomach there for you during that bedside. And eating and drinking foods at room temperature and liquid foods at temperature can help. So things that are too cold or that are too hot can sometimes affect that nausea too. And then slowly sip your liquids throughout the day. So don't think that you're going to be able to finish 8 ounces maybe or 12 ounces at a time. Just kind of sip a little bit throughout the day to keep up with your hydration needs. And then try to go from 2 to 3 big meals a day to 5 to 6 small meals, so it's easier on your stomach, to see if that helps you with nausea. And again, we want to not skip meals when your stomach is empty. Sometimes that can make nausea worse. And then rinsing your mouth out before and after you eat can also help reduce the nausea. And then sitting up and then trying not to eat anything an hour after you have vomited. You want to wait that hour time, and then try to sit up and stay sitting up for an hour after you eat. And then plan the best times that are for you to eat. Some people may be more nauseated in the morning, and so then we want to not try to force yourself to have breakfast or something then, that maybe the afternoons are the better times for you to continue eating. So kind of go with your times that you're eating. And I've also heard some people, like 2 o'clock in the morning, they'll wake up and they feel good and they feel like they want to eat, but it's 2 o'clock in the morning. But that's okay. So we want to try to eat when you can eat and when you can keep it down. And then keep that food record and food diary to see if you can figure out what are some of your nausea triggers. And then nausea, again, want to wait after you vomit about 1 hour before you start to try to resip things. Want to make sure you start with clear liquids so that you can keep those down. And then once you are able to keep those down, you can go to more full liquids, soups, smoothies, milkshakes. Once those are down, then you can switch back over and try to start eating again. Dry mouth. Dry mouth is one of the very common things that you can have. So eating foods that are easy to swallow. Our digestion starts in our mouth, so our enzymes help break down our food. So when we have dry mouth, it makes it very difficult to be able to tolerate dry foods. We want to make sure that you have things that either have gravy on it, that have some kind of salad dressing on it. You can also chew on some gum, some hard candies, some ice chips, some sweet tarts, those types of things. Take those sips throughout the day. Want to try to avoid alcohol. And do not eat anything that can hurt your mouth, because if you don't have the saliva, you have your dry mouth. Anything that's going to be crunchy, hard, those can cause lacerations in your mouth. And also anything spicy, salty, or sour may also bother your mouth too. And then try to rinse your mouth every 1 to 2 hours. And then try to avoid any mouthwashes that have alcohol in them, which most of them do. Water is just fine. And then use any artificial saliva. If you have not used artificial saliva, it is very beneficial. You want to talk to your doctor about that to see if that could potentially be an option. So foods, just the smell of foods is something that can cause nausea and vomiting. And so we want to look at things that may be triggers. So if the smell of frying bacon is one of those things, even if you're not eating it, if you start that nausea pattern, you may want to leave the room, open windows, turn on a fan, do something that if you are able to figure out what the triggers are, that you can help reduce those so that you can still be able to eat your meal. And taste changes. So red meat seems to be one of the things that can alter, that we hear a lot of feedback on. So try to do more fish, eggs, cheese, and poultries, and then try different spices and sauces and marinades. Things that you may not have liked before, you may actually develop a liking to that. And then try to, if you're going to do your meats, if you've noticed that those are not very appealing, try to add something sweet with that. Some juices, some jams, some marinades, and tart foods and drinks can also be very helpful. And again, if there's a metallic taste, we hear a lot about metallic taste and bitter taste. You can do gumdrops, lemon heads, some kind of other hard candy to help take some of that metal taste out of your mouth. And then try your favorite foods if you're not nauseated. And when you feel good, that's the time that you want to try those other new foods too. And then chew your food a little bit longer. That can help your taste buds. If you have dull taste, chewing your food a little bit longer can help activate those taste buds a little bit. And then teeth care and mouth care. Dry mouth can increase your risk of cavities. So we want to try to keep our mouth as moist as we can. And again, going over that bitter and that metallic taste, cooking with iron skillets can also even make that taste more metallic-y. And then eating with regular silverware, you may switch to plastic silverware. That can be a little bit helpful. And then add some honey, some maple syrup, something to kind of counteract that bitter taste. And then bland or no taste. So again, we're going to do as much flavor. So you may not have liked spicy before, but you may try that now and be able to have a little bit more tolerance on it. Just kind of play with the spices. And also things like pickles, hot sauce, vinegars, citrus dressings, things like that that you may not have been too fond of before. You may be able to do those now or during that time. And then there's also a solution to kind of wash out your mouth with water and baking soda and salt. You can talk to your doctor too if that was something that you want to check with them to see, to help kind of just rinse off your mouth between eating. And then that lack of hunger. We want to try to eat on a schedule, eat 5 to 6 meals a day versus that 2 to 3 big meals. And you may have to set alarms. You may have to keep a food journal to write down, because you may realize that the day you're running out of time in your day and you still really haven't eaten. So you want to really try to keep on those meal schedules if you can. And make your meals pleasant. Really set your table, get some flowers, have friends over. Try to do things that make your meals more appealing. And then try to drink your liquids in between your meals, or drink small amounts. We don't want to get filled up on liquid when we need to get that nutrient-dense foods in our stomach. So weight loss, we can look at adding extra calories, protein, protein-fortified milk, and foods that are high in protein, that you want to eat those things first. We want to eat our nutrient-dense, high-protein foods first to get those in, and then follow up with our fruits and our vegetables and those added sides. And then drink smoothies and milkshakes and soups, and eat foods that smell good to you, and that's the time to try new recipes. And then try to blenderize any of your drinks. Sometimes you're not able to do fruits and vegetables, but you can make that into a smoothie and potentially get that. And we want to make sure that we are eating, again, our small frequent meals really take advantage of that appetite. Whenever you feel hungry, that's when you need to eat. And then again, rinsing out your mouth to kind of help rinse out those different flavors. So I put together some high additive things. A lot of patients will come into clinic and they'll immediately talk about Ensure and Boost and those commercial products, which are completely fine to use. A lot of times insurance does not cover those and they can be quite costly. So I like to really use food as if we can to get those in there. Kind of looking at basically an Ensure, to start reading food labels and look at the food labels for your calories and your protein. So an Ensure is about 250 calories, about 7 to 8 to 10 grams of protein. So very close to that, you could have like a Greek yogurt and a cheese stick would kind of give you that same calories and protein in there. To get that, it's a lot cheaper. It's probably things that you already have. Mayonnaise, nuts, eggs, peanut butters are really good. I think that peanut butter has a strong flavor. You can also try maybe a time to try some of the other nut butters. So almond butter, cashew butter, those things have a nice amount of calories, but they don't seem to be as potent as a flavor, as strong as a flavor as regular peanuts. So sometimes that can help. Different salad dressings that you can add to there. Then powdered milk you can add in, a cream cheese, sweetened condensed milk, evaporated milk. Those are different calorie boosters that you can get inexpensively, that you can add extra calories to kind of help with weight loss. Butter is always a great one too. And another sheet there, cream cheese is a good one that you can look at. Sour cream, granola bars. Fairlife is one of the over-the-counter newer milks that you can look at there. Greek yogurt, Carnation Breakfast Essentials. Those are very similar to a Ensure, and they do have some vitamins and minerals in there. They're a lot cheaper, and most of the stores have a store brand to that, so you can look at those. And they also come in powder, so the powders are usually cheaper than the pre-mixed that you can mix with whole milk. And so we want to also look at hydration. Hydration is very important to stay hydrated. We want to continue to drink and make sure we're meeting those hydration needs. Want to avoid caffeine and alcohol, but always have some kind of water bottle or something with you to help make sure that we're able to meet our nutrition. Hydration needs also are very important. So here is a list of some nutrition supplements over the counter. There's Muscle Milk, Orgain, there's Ensure, Boost, Carnation Breakfast Essentials, Premier Protein. Those are all nutrition shakes that you can look at and talk to your doctor about. Also in our outpatient pharmacy here at Conway Medical Center, they are carrying some of those products that you can buy if you happen to be here at the hospital in a clinic visit and you want to stop by that outpatient pharmacy. You can purchase some of these products there if you would need to. And then also vitamins. We want to make sure that you talk to your doctor to see if you need to do a multivitamin with iron. We prefer not using the gummy vitamins. The gummy vitamins don't have minerals in them, specifically iron. And then really talk about vitamin D, your calcium, your iron intake, and your B vitamins. And myself is Kim Page, and Courtney Fuller is our outpatient dietitian. I have all of our contact information. If anybody would like to schedule an appointment, just have your doctor send us over a referral, and we can go over things a little bit more and talk about other ways specifically tailored to you that we can help with weight loss and ways to add in calories and increase your nutrition health as you're going through treatment.